What if your health was treated like electricity or water, essential, guaranteed, and protected by public oversight? Imagine a world where healthcare wasn't tied to your job, income, or zip code. This is the vision behind the public utility model for healthcare. But is it realistic or just a dream? Let's explore the facts, the future, and what it would take to make this bold idea a reality. First, what is a public utility? Public utilities are services we protect: electricity, clean water, sewage. They're too important to leave to chance, so we build systems that guarantee access. But here's the question: why isn't healthcare one of them? This isn't a new idea. After World War II, the UK launched the National Health Service, still one of the world's best-known publicly funded systems. Other countries like Canada, Norway, and Japan have versions of this too, each with their own mix of public control and private delivery. The US spends more on healthcare than any other wealthy nation, but ranks lower on outcomes like life expectancy and chronic illnesses. The burden is growing, not just for individuals, but for governments and employers. So what would a public utility model offer? 1. Guaranteed access. Everyone gets coverage, no matter their job, income, or medical history. 2. Lower costs. A single public system could negotiate better prices for medications and procedures. 3. Better health. With stable, universal access, we could focus on what matters most: keeping people healthy instead of only treating them when they're sick. Countries that treat healthcare as a public good tend to spend less per person while living longer. But let's be real. The idea of healthcare as a public utility isn't without its challenges. There's political resistance. People worry about losing choice or trusting government too much. There's also the question of funding. Universal systems require upfront investment, but over time, they save billions. And some worry about bureaucracy, long waits, slow processes. That doesn't have to be the case. Many public systems run efficiently with the right design. Still, the ground is shifting. Aging populations, rising chronic diseases, and worker burnout are creating pressure for change. New technology like telehealth, wearable monitors, and AI can make public systems smarter, faster, and more personal. Is a public utility model for healthcare realistic? Maybe not overnight, but it is possible if we focus on creative, gradual reform. At Nurses Transforming Healthcare, we're exploring what this could look like in real life. Not just more care, but smarter care, closer to home. We call it Flip the Zip, reimagining healthcare as a public utility delivered at the neighborhood level. What if every zip code had a nurse-led clinic focused on wellness, food access, housing, and early care? That's what public utility healthcare can mean. Not just a doctor visit, but a full system that supports health before crisis. Healthcare is a human need. The question is not whether we can afford to treat it like a utility, it's whether we can afford not to. So what do you think? Can we design a system that puts people before profit? Comment below, like, and share if you believe healthcare should be a right, not a privilege. And join us at Nurses Transforming Healthcare to build a better future, one patient, one policy, one public utility at a time.